The Interdisciplinary Clinic is a UBC project that is supported by the university. It is a graduate program that takes and focuses on training students to work with individuals who are having mental health problems.
A number of our programs, psychology in particular, and social work, have been working towards getting an opportunity to bring clients, outside people, into the clinic for various kinds of treatment.
Focuses on training students to work with individuals who are having mental health problems. The School of Social Work is currently focusing on children, adolescents, and families, psychology more so on the issue of adults, and nursing more on issues of health and grieving.
One of the advantages of the space we have is that we have the opportunity for students to watch what's going on live, and we do that by essentially a one-way mirror.
The benefit of this being a training clinic is the fact that there's always supervision for us. So no matter what we do, we always have support from our senior clinicians.
The idea of a university sponsoring a clinic is very unique. We are, as far as I know, the only clinic that is interprofessional that in all of North America, so including the United States.
The social work and the psychology program have the expectation that we're going to be closely related in a number of ways, because the various professions, the clinical social workers, the clinical psychologists, they do different but similar kinds of work. And it is because of the size of the institution and because of the people and their willingness to be innovative, their willingness to sort of push the traditional boundaries, to not say this is mine, stay away from my particular patch, but rather the sense that a collaboration is more likely to end up producing optimal outcomes for the clients. So the client might start off in one locale and then have the file in essence picked up by others so that we can offer a more of a full service kind of approach. It's no longer the isolated specialist, but rather a team that usually results in the best outcome for patients, and hopefully the interaction between students of the different disciplines will create that sensitivity and that ability to recognize that we all contribute in significant ways to the process.
To run a clinic, we've had to learn to work together. What brings us together is that all of the training is focused on the idea of teaching the most current evidence best practices. In fact, our real goal is to train a number of students to become the next leaders in mental health within the community and hopefully within the Okanagan Valley.
It's a real privilege to actually be in the clinic because you're getting supervised clinical experience and you're actually doing the work. You're doing the counseling, you're doing really what social work clinical counseling is. As far as experience, I'm really excited to be part of the clinic.